Welcome and hi everyone. In this episode, we are going to discuss about a 68-year-old lady who came to the emergency department with a chief complaint of shortness of breath. So, before we start, as always, let's see the patient. Okay, so as you can see, our patient is a 68-year-old lady who came to the emergency department with a chief complaint of shortness of breath. In the emergency department, the doctors found out that she had hypertension, tachycardia, tachypnea, and also some edema in her lower extremities. So, they decided to admit her in the internal medicine service for further workup. Now, she is in the internal medicine ward, and it is time for you to do your history and physical examination. As always, we will start with the history. So, when you are taking the history, don't forget to ask about the 8 attributes of pain. Whenever a patient comes with shortness of breath, it is really important to ask about the 8 attributes of pain because pain is the main symptom of a myocardial infarction. Okay, now let's listen to the patient. So, the patient tells us that she has hypertension, but she is not currently on any medications. She has a past medical history significant for hypertension and hyperlipidemia. She also tells us that she has a 40-pack year smoking history. The reason why it is important to know the patient's smoking history is because smoking is one of the risk factors for lung cancer. And in this case, the patient has a 40-pack year smoking history, which makes it more likely that she might have a lung cancer. Now, let's move to the physical examination. The first thing that we are going to examine is the vital signs. So, when you examine the vital signs, you will find that the patient has a temperature of 98.6, a heart rate of 120 beats per minute, a respiratory rate of 24 breaths per minute, a blood pressure of 150 over 100 mmHg, and an oxygen saturation of 92% on room air. So, as you can see, the patient is in a moderate respiratory distress because her oxygen saturation is 92% on room air. Also, we are going to note the patient's level of consciousness, which is alert and oriented times 3. Also, we will note that the patient is in no acute distress. Now, let's move to the cardiovascular examination. So, when we examine the cardiovascular system, we will listen to the heart sounds using the stethoscope. As you can see, we will listen to the heart sounds at the 4 cardiac borders. And in this case, we are going to find a new systolic murmur. The presence of a new systolic murmur could be a sign of a mitral valve regurgitation, which in this case is a possible diagnosis because the patient is a 68-year-old lady with a history of hypertension. So, after you finish your history and physical examination, you will notice that the most likely diagnosis for this patient is hypertensive heart disease. Hypertensive heart disease is a condition in which the heart becomes enlarged and the heart muscle becomes thickened as a result of chronic hypertension. Hypertensive heart disease is a condition in which the heart becomes enlarged and the heart muscle becomes thickened as a result of chronic hypertension. Significantly increased systolic pressure compared to diastolic pressure can result from age-related arteriosclerosis, which causes arterial stiffness. Okay, thank you so much for watching. If you enjoyed the video, please remember to like and subscribe. Until next time.